Long-lasting impact of public health dentistry. Authored by Michal Herman. This article reflects on the enduring impact of public health dentistry through the author's 25-year professional journey serving underserved and marginalized communities. It examines persistent barriers to equitable oral health care, including workforce shortages, inadequate insurance coverage, racial disparities, and limited access in rural and low-income populations. Drawing on experiences in nonprofit and community dentistry, the article highlights the importance of mentorship, advocacy, leadership, and community engagement in addressing oral health inequities. It argues that public health dentistry represents a form of professional altruism grounded in service and social responsibility, and calls on dental professionals to expand access, support workforce development, and inspire future generations. Addressing persistent disparities in access to equitable oral health care is one of the most important but often overlooked aspects of our profession. We practice in a world where the oral health safety net is limited and fraying. Traditional dental insurance programs provide limited coverage to the population that can access them. Programs like Medicaid, intended to offer comparable access to care for their members, fail when the number of providers who accept the plan is insufficient to meet growing community needs. Recent and future pending cuts will continue to increase the number of uncovered, uninsured families. Many rural areas in the United States are deemed dental deserts, lacking sufficient oral health professionals. Programs for seniors, U.S. veterans, people with disabilities, and pregnant women do not provide sufficient coverage for comprehensive dental care. Against this backdrop, public health dentists dedicate themselves to professional altruism and create pathways for change. I write to share insights from my 25-year journey as a public health dentist. I hope to encourage students and colleagues to look beyond the traditional private practice and consider the lasting impact our profession can have on children and disadvantaged, marginalized communities. I remember sitting in my dental school interviews. Young and intimidated, I told the admissions staff that I wanted to become a dentist to help people. I was not alone. This was a common theme among friends and fellow applicants. But in the classroom and study groups, we focused on practical skills like restorative, anatomy, and pharmacology. No one talked much about using our new skills to help the underserved. While my dental school was in an urban area and the patients who sought treatment from green dental students were often uninsured or underinsured, the concept of public health dentistry was never discussed. By the end of 4 years of rigorous study and much stress, many of us were drowning in student loans and envisioned a shiny office that could help pay back the hundreds of thousands of dollars in debt accumulated over the years. Maybe even have Wednesdays off. A few of us wanted something more. We remembered our meaningful experiences treating children from community schools with their rampant decay and a shared family toothbrush, or the homeless man who came in with a tooth in his hand. We yearned for an alternative career path. I did my residency at a public residential medical facility, and my passion grew stronger. Sometimes you need a mentor to help find your purpose, someone who leads you in the right direction and makes you see the world differently. I was lucky to have a residency director who listened, guided, and kept that spark lit. During my residency and in my early jobs as a dentist, I had the opportunity to experience various types of community dentistry. I treated inmates, unhoused people in the cold New York winters, juveniles with addiction disorders, union members, AIDS patients, teen runaways, and school children. Through these experiences, I found my path to public health dentistry. Public health dentistry comes in many forms, but in general, it focuses on promoting oral health and preventing dental diseases across the community as a whole. Practitioners in this space believe that we must empower communities by investing in oral health education, raising awareness of the importance of dental health to overall well-being. We use research to inform methods of prevention. We advocate for improvement in access to care through data surveillance, insurance reform, and public policy, and we develop innovative programs to build long-term success. The following are examples of troubling barriers to oral health care in underserved communities. 57 million people live in dental health professional shortage areas, many in rural communities and areas with a high rate of poverty. The rate of dental disease is nearly 3 times higher for young children from low socioeconomic groups. Untreated caries are 2 times more prevalent in working-age Black adults than in non-Hispanic whites. Dental sealants remain a challenge in non-Hispanic Black children, with sealants reaching only 32% of the population, reflecting underutilization of preventive visits and measures. A shortage in registered dental hygienists in the U.S. contributes to these disparities, as providers struggle to fill their positions, pay the demanded increased compensation, and complete both preventive and restorative care. 2. Recruiting and retaining dental assistants and dental hygienists is a challenge, particularly in community dentistry settings, where compensation cannot compete with the private sector. The Health Resources and Services Administration, HRSA, forecasts a considerable shortage in the dental workforce by 2038, particularly in rural communities that are already lacking equitable social determinants of health. It is expected that over 33,000 additional dental hygienists and nearly 20,000 additional general dentists will be needed to meet the growing population's needs. Yet there are threats to federal loan redemption programs and educational loans, which have traditionally helped attract the workforce to underserved communities. Structured programs, through private and nonprofit organizations that introduce dentistry and allied dental health careers as early as middle school and high school, are essential to narrowing the gap. There are many different paths to public health dentistry. Some may enter a formal dental public health specialty program or complete a postgraduate advanced education in general dentistry, AEGD program that serves communities in need. Others will take advantage of loan forgiveness programs that place providers in health professional shortage areas, join a community health center, a local health department with a dental component, an educational institution, or other pathways. And others, like me, will find their way. As a young dentist and a new mom, I volunteered for and then became employed as a dental provider with KinderSmile Foundation in New Jersey, a 501c3 organization with a mission to provide underserved children, perinatal women, and families with access to comprehensive dental care and educate children and their families on the importance of dental hygiene. KinderSmile Foundation was established in 2007 by Nicole McGrath Barnes, DDS, FACD, who became a pioneer in the community in the same year as the death of DeMonte Driver, a 12-year-old boy who died from a tooth infection that traveled to his brain. In addition to her role as CEO, Dr. Nicole is a mentor, friend, and advocate, and she has helped me see in myself qualities that I did not know I had. With her faith and guidance, I have grown into the role of Chief Operating Officer and found my voice to advocate for so many others. There is so much need in the community we serve. In most states, including my state of New Jersey, oral health has not been a priority and is typically seen as separate from overall health. We dedicate ourselves to changing that. We fight for the communities we serve by linking families to dental homes to ensure continuity of care, providing low-cost or free direct services to patients, establishing medical-dental integration programs, mentoring high school, college, and pre-dental students to encourage them to consider a career in public health dentistry, creating workforce development initiatives, and engaging in public and legislative advocacy. Through expansion and continuous development of new programs and initiatives, we demonstrate dedication not only to raising awareness of the gap and inequities in access to oral health care, but also to advocating for systemic change towards a vision of a future where every child has access to a dentist and preventable dental diseases are eradicated. As a foundation, we value efforts to support the professional development of our staff, provide grant-funded opportunities to advance our dental assistants towards Certified Dental Assistant, CDA, or Registered Dental Assistant, RDA licensure, and offer additional professional coursework for our front desk patient coordinators and community health workers. We participate in and host career days, service days, mentoring programs, and scholarship opportunities to promote the dental field, starting at the most impressionable age. We introduce students in marginalized communities to avenues they had not considered, confirming that patients trust providers and staff who look like them and are relatable, and that the value of practicing in public health settings is immeasurable. Working for a nonprofit is hard. We have limited resources and so much to accomplish. Success lies at the intersection of the 4 pillars of the American College of Dentists' mission of advancing excellence, ethics, professionalism, and leadership in dentistry. The American College of Dentists, ACD, includes altruism in its definition of professionalism. From my journey, I have learned that to be a leader in the dental profession generally, and in the nonprofit world in particular, you need to lead by example. This means acting with humility, accountability, compassion, and drive, training the next generation. Wherever you practice, I encourage you to mentor, support, and inspire young professionals. Leave that legacy and spark in others. To me, leadership also means leading by doing. I joke that I never say no to work projects or assignments. Never. To continue to grow professionally and as an organization, you have to explore opportunities. Working with and learning from Dr. Nicole, we have led the foundation with plain hard work. We have called families from the original crowded, paper-filled office, established partnerships with community programs and dental homes, and volunteered to provide oral health education at schools during our free time. And there is a relentless need to fundraise. When a grant opportunity comes my way, a meeting, a coalition, an engagement, or a fundraiser, I always find a way to complete it or attend. It may crowd my calendar or add another deadline, but my response is always that, if it could make a difference, I will find a way to complete it. Always. I was asked to participate in strategic planning meetings for the New Jersey Dental Association, NJDA, in 2024. While I was initially reluctant, in the end, my little voice made public health dentists heard and understood. And with leadership support, the words public health and access to care were, in fact, added into the plan. That experience took me back to the time in dental school and shortly after, when I felt public health was viewed as inferior and providers who chose to pursue it were deemed inadequate. But hearing my own voice speak loudly and proudly about the need and what we see every day in our work was an experience I will never forget, making my efforts to inspire others to join the field more purposeful than ever. At Kindersmile Foundation, we lead by example, with quiet confidence, humility, appreciation, and respect for all. Arrogance is not the sign of a good leader. Quiet confidence in leadership is a sign of respect and empowerment of others. Those who are here for the right reason, who truly embrace the community, who are passionate about serving, are naturally humble leaders. They are the ones who succeed and can carry on the mission and vision with empathy and compassion. To me, public health dentistry in its true sense is real-world altruism and benevolence. It is embracing the community and its needs holistically. It is making an investment in the families, spending the time needed to understand their struggles, and truly giving back. It is entering a field dedicated to the betterment of others, with the understanding that some days will be difficult, emotional, and demanding. And it is the great feeling at the end of every long day, after extracting multiple teeth on a child with rampant decay, making a denture for a 15-year-old, or hugging a crying mom who struggled to bring her child in for 2 years. It is providing care and supporting families wholeheartedly, actively listening, and making an impact. It is meeting with state legislators and presenting the stories of our own patients, asking for their support of initiatives to increase the Medicaid reimbursement rate, ease the credentialing process, fund maternal oral health programs, and other public oral health curricula. There are not nearly enough dentists participating in public health. Dental public health specialty programs are becoming more prevalent, but as of today, there are fewer than 800 providers who have completed a dental public health specialty program, or only 0.39% of U.S. dentists. The 6,000 dental providers who work in public health settings comprise only 3% of U.S. dentists, an obviously inadequate number of providers to care for the community in need of expanded services. Only 33% of U.S. dentists accept any patients on Medicaid, 10% less than the reported national estimate, caused by those who remain on the Medicaid provider roll while no longer accepting members. The need is growing in light of upcoming cuts in Medicaid coverage and social services benefits, and attacks on the promotion of fluoride for prevention. Being a public health dentist in urban communities in New Jersey, one of the most diverse states with one of the highest racial disparities, means that the majority of our patients are Black and Hispanic. In fact, only 6% of our patients are non-Hispanic white. In the U.S., Black and Hispanic children are affected by dental disease at twice the rate of white children and are less likely to see a dentist. Lack of access to oral health care is only one of many barriers that our vulnerable community faces. Structural racism over many years has led to endless disparities in access to care, education, housing, and nutrition. Working as a community to break down walls and create pathways for mentorship and opportunities helps reduce inequalities in the social determinants of health. It is that simple, but community collaboration is necessary. Dental disease is the most common childhood epidemic for low-income children, yet it is vastly preventable, but only with adequate avenues to bridge the gaps. We recognize that pursuing dental education is incredibly expensive, and crushing student loan debt makes it difficult to foresee a significant increase in the number of early career dentists entering the field. This is why we keep talking about it, writing about it, and teaching about it. Simply said, public health dentistry will likely not lead to a glamorous lifestyle, but it will absolutely lead to fulfillment and gratification. For me, there has never been a question. It has always been an honor to serve the underserved. The nonprofit world is notorious for high employee turnover for a multitude of reasons. Many times, it is because we proudly hire from the community we serve, where many have competing responsibilities and obligations. Often, it is due to compensation. Even when the heart is in the right place, nonprofit organizations cannot compete with private dental practices. Other reasons, as always, include relocation, family, work, or personal relationships, and more. Some employee departures are difficult both practically and emotionally. Teamwork and a culture of all hands on deck help tremendously. The resilience and humility of the core leaders who keep an eye on the big picture help navigate these transitions. When there is a crisis or a sudden departure, I am used to putting my deadlines and projects aside for a moment. I will always find time to get back to them when the rest of the staff goes home. For me, much more important is the team's immediate support under all circumstances. A good team is fostered by mindful leadership, guidance, and love. I will do everything in my power to create or reinforce that sense of mentorship and support over and over again as teams fluctuate. We always say that everything happens for a reason. My personal journey in public health dentistry has led me to a position I could not have dreamed of, one that allows me to grow as a person and as a professional. I am eternally grateful and dedicate every ounce that I can because it feels like we are on the cusp of making a change. I have a mentor who still inspires me every day. She has taught me how to put into words my passion for my profession, my compassion for children and families, my drive to raise awareness among stakeholders and make access to care equitable for all, and my love for mentoring others. This is my purpose as a public health dentist. With all of that, I will admit that it can sometimes feel lonely, but every night I look back and think of how everything ultimately falls into place. The mission of the organization and the purpose of the work always come to good. As I like to say, all good. I am not shy about asking others to support the legacy and carry it forward. There is so much need in our communities, and there are many opportunities to contribute. If you haven't yet, find a nonprofit or a community center to volunteer with, whether you can offer once a week, once a month, or just once. Call or write to your legislators on behalf of the families who need expanded access to care. Write about the child you saw on the school visit, or the mom who did not qualify for the plan, the senior who could not afford dentures, or the veteran who had given so much but still couldn't chew his food. Ask for their support in making oral health a priority. Donate to oral health expansion initiatives and to pathway programs. We are all in this together, healthcare providers who entered the profession of oral medicine for the betterment of others. I have learned through my work to use my voice on behalf of others whose voices are still soft. Our voices together can be powerful and influential,